Well, my name's Valdez-Gonzalez. I chose to do PTSD in cancer patients. Some of my slideshows is just practically an overview of what I wrote about, and it doesn't mention everything, but just a small overview. So I did statistics for PTSD and for PTSD in cancer patients. I did both just for comparison reasons. So what I read was that for PTSD in cancer patients, it's like 1 in 5 cancer patients are more likely to get PTSD, and then 20% of cancer patients are more likely to get PTSD. And then with PTSD, actual PTSD is post-traumatic stress disorder. That usually happens after having this severe traumatic event, and a lot of people refer to PTSD as to like serving in the military or different stuff like that. It's very sterilized in that area, but PTSD really can happen to anyone. But yeah, I wrote over what I also researched, I didn't put on there, was over 3 million people in the USA a year get diagnosed with PTSD. PTSD is unfortunately a mental illness, which means there's no cure. There is medicine, there's several things to treat the symptoms of it, but there's no actual cure for it. Statistics wise, there's 70% worldwide people that face a traumatic event, but only like 5% of worldwide people actually get diagnosed with PTSD. And it's even less with having PTSD in cancer patients. A lot of people tend to think that cancer patients are sad all the time, and that's a normal thing. That's like a society norm or a stereotype. It's very stereotyped kind of thing, because you shouldn't be that sad kind of thing too. But yeah, it's very a stereotyped kind of thing, just the way I see it. But yeah, that's all. And then PTSD also is more common from age 19 and older. Usually age younger, not as common, but as soon as most people hit 19, it's very more common. And then symptoms for PTSD. There's really several symptoms, like it's case by case kind of thing. I know I saw a lot of people have nightmares and flashbacks, which I had a lot. And it's different when you're when I was doing treatment, and when I still go to the doctor now, but it was just, I would avoid the doctor, and it stresses you out. And so, which is one of the symptoms. And yeah, people, there's many symptoms, like I mentioned right there, that one of them is like people avoid going through the same, like per se, I have trauma from when I went to Augusta. That's the hospital I went to. I have trauma from going there. That's why I stopped going there. But yeah, that's really one of the big things, especially in PTSD in cancer patients. You will always remember that. But yeah, and the crazy thing is, a lot of people who first get diagnosed, it takes them a minute, which it's really PTSD. I feel like I got PTSD from the moment I found out. It takes them a minute to kind of deal with the whole thing. I know a lot of people don't really know how to deal with it. I didn't know how to deal with it, especially being 17 at the time. I had no idea what was going on. I also read that most people, when they first find out, instead of going to their doctor's appointment, they skip it, and 12% of those people that end up not following up to a referral, an urgent referral, end up dying, are 12% more likely to die within 12 months. But yeah, unfortunately, that's the reality. And different symptoms. I mean, there's several symptoms, and it's not just PTSD and cancer, but PTSD in general comes with the same type of symptoms. I know my husband always, when he came back from Syria, I think it was like when he was driving, or when he was just outside, he would always, or it'd be hot, it'd always remind him when he was in Syria. So it kind of brought him flashbacks just out of nowhere. But yeah, you do tend to experience a lot of anxiety, and you feel very helpless. And when you have PTSD, unfortunately, a lot of the cancer patients that do have PTSD and don't know they have PTSD go undiagnosed, or they decide not to treat it, which really sucks. Different treatments. There's several treatments. There's really, really good treatments out there. I personally used a support group. I chose to use a support group because it's just, I felt better. I felt more comfortable, especially because at the time I was only 17 and I was on God knows how many medicines. And so I already couldn't take certain medicines. So at that point, I just didn't want to take more medications, or then be told I can't take it. Recently I actually tried an antidepressant and it did not work. It did the opposite for me. So I don't know. I wasn't like, when I first found out I had PTSD, I didn't think of it. I mean, I knew it was sad, but like, I don't know, I was really always happy around others, and honestly I was in denial most of the time. But yeah, and I tried an antidepressant recently, and it's crazy how much a medication can affect you. Like, don't get me wrong, if a medication's all for you, go for it. But it was not for me, so I chose to do support groups. There's different support groups. I actually changed doctors. I go to an oncologist in Atlanta now, and we have a support group in Macon, actually. So it's really close by. You meet people that understand you, and honestly, the group I'm in, they specifically went for the same type of cancer I had when I was 17, but they're survivors, and you talk about their stories, and they're really just there for you, and I feel like they understand you better than just anyone. I have a caseworker too, and honestly, I can't, till this day, it's so hard for me to talk to my caseworker. But in the support group, it's so easy, and it's helped me a lot. It's helped me actually talk about my sickness when I was sick. Other different types are therapy, which is crazy because, I don't know, for me, I don't think I do therapy. It's just kind of weird. But for some people it does work, but usually when you're a cancer patient, you have to go to it's called a psychotherapist, but it's psycho-oncology therapist, which is specifically for cancer patients that are dealing with PTSD. But yeah, they're there for you, and they kind of understand where you're coming from, because that's what their profession is. But yeah, I didn't really see much about that. But yeah, I really do think support groups help a lot, especially because you get to talk to actual people. It's not someone that's trying to make you feel better. It's actual people that just want to hear you. And then mental and physical effects from PTSD. I found a lot of mental, because it is a mental illness, but physical effects wise, I didn't really find any. But it's just, I did read about, I think it was at Harvard Law, EDU, and so, well, not Harvard Law, but Harvard EDU, and so, I was reading about how physically it won't affect you, but after so much time of just undergoing PTSD, undergoing the stress, the anxiety, the helplessness, it stresses your body out. And they quoted, the one good quote that they said was that your body's like a car. After so much stress over and over again, your body gets tired and starts to wear out. And things, your function, like your body parts start to wear out. But yeah, and so, it's just like you're constantly, just overworking your body. And so it causes you to, causes for your muscles to not be as strong, and there's wear and tear. And so, that can in the future later lead up to different heart conditions like a stroke or a heart attack or cardiovascular disease, because you're putting your body under so much pressure. But yeah, and same with age. Unfortunately, it's more common. PTSD is more common between 19 and 40-year-olds. So you already stressing your body out from dealing with PTSD. Just speeds the process up, really. But yeah, unfortunately, since it is a mental illness, there is no actual cure for it. There's just cure for the symptoms. And these are my references.